Your Excellency, the President and the Commander-in-Chief of Kenya Defense Forces, Your Excellency, the Chair of the Council of Governors and Excellencies Governors, PSS, the CEOs of our referral hospitals, the CEO of Digital Health Agency, the CEO of Social Health Authority, our valued partners, the vendors. Your Excellency, mine will be very, very short because what we are doing today is part of the universal health coverage. And I want to say it here, Your Excellency, with confidence that the role of our county governments is indispensable. Our ministry's collaboration with the county government has been excellent, and we are not only upgrading the healthcare infrastructure, but we are transforming how medical equipment is procured, is utilized, and is managed across our country. Your Excellency, the matter of decommissioning of the obsolete medical equipment have been raised. These are very essential, and we are working with the vendors and we are working with the suppliers and the county governments on how we can deal with this matter. Your Excellency, this program, the National Equipment Supply Program, known as NEST, both our two levels of government are working together to implement a more efficient system of equipping our healthcare facilities. And this partnership is grounded on how we can implement a new, more efficient system of equipping healthcare facilities. It's grounded on collaboration, ensuring there's bulk procurement, centralized payment system for medical equipment. On the Social Health Authority and the Digital Health Agency, which are very, very key players in this ecosystem and in this transformation. So DHA's effort in digitizing health service are crucial for streamlining and improving transparency. As of today, Your Excellency, will give more information. Over 28 million Kenyans have registered under SHA, and we have nearly over 10,000 health facilities. And this has come because of the collaboration between the two levels of government. Your Excellency, as we speak here today, to give the numbers, today you have launched 14 CT scans. You have launched 2 ultrasounds to various counties. You have launched 1 digital X-ray, and you have launched and sent to over 30 of our counties 30 dialysis machines across our counties. In the next batch, and I want to give commitments of the dates we are going to dispatch. In the next 2 months, by 31st of August 2025, we will have dispatched close to, by 31st we will dispatch 18 digital X-ray. By 31st of September, we will dispatch 40 digital X-ray. By 30th of October, we will have dispatched 25 digital X-ray, and the last batch by 31st of December, we will have dispatched 140 digital X-ray. By 13th of August, which is next week, we will dispatch 65 ultrasounds to various counties. By 10th of August, which is 2 days to go, we will dispatch 19 CT scans, and by 15th of August, we will dispatch 100 theater equipments to all our counties, and by 15th of August, we will dispatch 100 routine laboratory equipments across all our counties. As we are sitting here, Your Excellency, there are over 25 ultrasound machines already functioning in our counties. We have more than 6 CT scans, and Your Excellency, let me give a vivid example to you. I went to King Fahd, and Governor Timami is here. King Fahd in Lamu Island. Today, there is the latest CT scan in King Fahd. There's a modern theater in King Fahd, and there is a modern oxygen plant in King Fahd. And that tells you the people of Lamu Island and Lamu County used to travel all the way to Mombasa County, Mombasa PGH, to get that services. Most of them used to die on the way. So there's oxygen, there is a CT scan, there is theater, there is a private wing. So that is one of the far-fetched counties. If you go to Wajir, where the chairman comes from, today you'll find CT scan, there is routine laboratory, in even as far as a place like Griftu, today as we are speaking here. Tharaka Nithi, if you go to Chuka Referral Hospital, you'll find ultrasound. And if you go to Machakos, Makweni, Kirinyaga, but Your Excellency, I just want to ask the governors two things. Three things. One, we have finished everything. We have signed the agreement of the IPA. The Digital Health Agency, the Social Health Authority have configured the ecosystem, and the fee for service escrow account is up and running. And I want to assure the vendors that in the next 2 weeks, the money will be in your account. We will deduct the money at source. We don't want it to be deducted at the facility. And that is what we agreed with the Council of Governors. Two, there are 2-3 counties, and the CEO of Council is aware that equipments have been delivered, but they have not been installed. I really ask those counties to help us that these equipments are installed. I want to thank 3, 4, 5 governors of the equipment that you have launched today. They wanted some little investment in infrastructure. And I talked to those governors, the governor of Nandi, the governor of Garissa, the governor of Mombasa, a number of them. And I really want to thank them because between last week and today, they have done that small infrastructure. Please, can we clap for them? So that tells you today, Your Excellency, the Social Health Authority, the Digital Health Authority, these equipment, nobody is paying for. The government, the national government is not paying for, the county government is not paying for. It's fee for service, and the maintenance and everything is done. So, Your Excellency, with those many remarks, this is what you have anticipated. It was part of our agenda for the people of Kenya. And as we continue to implement this important, I really want to urge our county governments to remain committed, all of us, to these reforms, to collaborate fully with the government. And by working together, we will build a very resilient health care system that provides quality service to every citizen and moves us closer to the realization of the universal health coverage.